All right, going through squats to start with. Total gym's a great way to start. You can decrease the incline if you want to make it easier. That way we've got nice controlled weight bearing status, really safe way to begin that type of motion. When you do it, you want to make sure that you have the person scoot up on the sled before they place their feet. Otherwise, they're not going to be able to really move very far when they dip that back down. So you have them lay on the back. You can vary their foot placement. I would generally start a little bit wider than shoulder width. Feet fairly parallel, potentially toed out just a tiny bit. And just depending on their pathology, if it's hip or if it's knee, would dictate kind of how far down you're going, how many reps you're doing. You can certainly do it one leg and isolate. Great way to do one leg closed chain where they're not really having to stabilize anything a whole lot compared to being in standing. So super place to start. From there, we can go to different standing options. Squat rack, traditional back squat. That's where you're going to be able to load the heaviest amount of weight on somebody. Basically bringing it behind their shoulders. Form is really the most important thing, and you want to really make sure that the person maintains a lumbar lordosis when they're going down, sticking that butt out and coming back up. I'm not big on going any lower really than parallel to the ground with your femurs. So that's kind of the way that you're going to typically be able to push the most weight. Front squat you can do as well. Typically not going to be able to push as much weight, but it's definitely safer for the cervical spine than the back squat. A lot of people put too much weight on the back of their neck. Most challenging standing squat, I'll use these big ones. It's going to be the overhead. So you're basically up here and trying to come down. A lot more to stabilize, significantly harder. Going to get a lot more core as well as what you're working at with the legs. We've got our squat matrices, which basically just means varying your leg position. So you can start out with your standard squat, coming in here, stagger your feet a little bit, squatting. Just going to target different parts of the different muscle groups. While you vary those angles, you can do them with a little bit toed out and squatting, potentially toed in a little bit. And again, you want to kind of think about which part of the muscle is injured, which part of the muscle and which part of the tissues we're trying to stretch when you think about how you want to vary that stance placement for the squats. All right, so hamstring curls on the Total Gym, we don't have the actual good attachments for it, but you can kind of rig something up like Johnny and I did right here so that you can work them a little bit. But my shoes are slipping off, so it's not great. But something like a towel wrapped around there and secured might be a little bit better for that. The other closed chain hamstring option that we've got that's fairly commonly done is just your scoots on the stool, not like Xander had in the lab. So that's the other hamstring option. Other things that we have for closed chain, we've got our deadlift options. So you can do your straight leg deadlift, essentially keeping the knees fairly locked out. You do want to kind of keep a little bit of a lumbar lordosis in there so you're not curling that low back and you're just bending down as far as that patient's able to and then coming back up as they do that. You want to keep the head and the chest kind of up a little bit. Don't let your trunk curl, and definitely don't let that lordosis reverse when you're doing any kind of deadlifting. I'm a big fan of the single leg deadlift. I usually use these kettlebells. They're different sizes, so I do 2 sets and I switch which hand I hold the heavier weight in, but keeping the knee basically fairly straight and just hinging at the hip. I haven't practiced them in a while. So it's definitely a balance exercise, but also a strength exercise. So just coming down, coming back up. And you want to think about just hinging at the hip when you're doing any of your deadlifts. That's the primary joint where we should be seeing motion taking place. All right, moving into lunges. Lunges, you want to keep the shoulders back. You definitely don't want the person leaning forward at the waist when they're doing it. So you want to have them looking kind of more forward than anything. Basic lunge, forward lunge, stepping forward. As you drop down, you want the tibia to stay vertical You typically don't want to see the knees get in front of the toes when you do that. So it's not like going sit to stand. You typically don't want to go much past about here as you're doing that. And so you can do it keeping the feet in place and just going up and down, or you can do it essentially taking a step and then pushing back with each one. So that's your standard. You can do a reverse lunge where you're going to take that step back a little bit. It's going to get a little bit of an eccentric load on the front leg quads, stepping back that way. We've got lunges to the side, so that's going to get more of your abductors and adductors, a lot more lateral quad, vastus lateralis, on the leg that is stepping away. And then you can also do diagonals, so kind of splitting the difference between front and lateral as well as between posterior and lateral. So get some variation there. We've got wall squats, so wall sits, either bilateral or unilateral, just trying to increase in muscular endurance typically with that one. We've got step ups. I picked the most challenging box. You can have people come up all the way, and you can vary whether you just go up and come down. You've got lots of options. Again, you can come forward. You can have the person step off of it, so it's more like a big step. You can do them sideways, again, to get a little bit more on the lateral muscles as you're doing it. And sometimes people have a little walk over too, going laterally. So you got lots of options with your step ups, lots of variation. All right, terminal knee extensions in closed chain. So when we think about terminal knee extensions, we're typically talking about from the 30 degrees of flexion to fully extended is kind of the typical range. And so your short arc quad would be an open chain version of doing a terminal knee extension exercise. It's going to be a lot safer early on. It's generally a little bit better for ACL repairs early on to kind of work on that before they get into full range. But with a TheraBand, you're basically looping it behind the back of the knee in that popliteal fossa, and then have the person weight bear and then just try and contract the quads. I'm having to overcome the resistance of the TheraBand as I straighten that knee out. So I'm getting more resistance than I might with just an open chain, certainly if it's just the amount of the person's leg weight. But I'm closed chains, I'm getting joint compression and the other benefits of having weight bearing taking place as we're doing that exercise. Okay. All right, four-way hip. Basically just looking at flexion, extension, abduction, and adduction are your typical motions. We call it closed chain because it's not the leg that has the resistance applied to it that's getting the work. We're trying to work the stance leg. So I can stand facing this way and essentially try and keep my knee straight on the moving leg, but I'm having to do a lot of stabilization on that plant leg as I do that. If I want to get more of the extensors, just need to flip around and extend backwards. Again, you might want to have something to hold on to for the patient to help with their stability, or you might not if you want to challenge their balance a little bit more. And then coming this way, coming across the body, and then turning the other way and moving away. Well, need something to hold on to. All right, so we're doing some exercises with a TheraBand in closed chain, essentially allowing the person to be dynamic in their movements, but trying to kind of engage the muscles to target whatever's weak. So you can vary the foot placement, but you're basically just having the person walk in some form, tighten up the band, use whatever resistance level you need in the band to get whatever you're after. If you're trying to work more on extensors or flexors, if you want to get more abductors, adductors, you can kind of work on varying that leg position and swinging it around. Green band's probably a little light for most people, but maybe not. It's close to St. Patrick's Day, so it seems seasonal. We've got I forgot about the lateral one. My bad.
I was just excited about the walkaways.
I know. I was excited about the walkaways. Super common lateral walk. Have the person get kind of a wide stance to start with, and then just stepping sideways. Typically you want to keep them in kind of a squatted position a little bit. Really good for working on those hip abductors, TFL, glute med in particular. All right, walkaways. Since you got your waistband that you're going to put on the person, buckle up. Things are about to get wild. Figure out how to tighten up the belt.
It's not the easiest one.
It's not. I thought those gate belts were tricky. All right. Or just gain some weight. Oop.
Faster, Craig, faster.
Let's try that again.
Woohoo!
I'm flying.
You look like a ballerina.
That's right. I felt like Peter Pan. All right, hip hike and pelvic drop. You can do it on a curve, on any kind of little box. Essentially trying to work the abductors on the stance leg. You're going to let the one leg be free of the box or whatever you're standing on and let that hip drop. So I'm letting the left side of my pelvis drop and then I'm trying to raise it up. So it's essentially trying to really engage those abductors on my right leg in this position and trying to just get that pelvis to shift up and down. Rhythmic stabilization. We think of it as for the trunk as a primary PNF technique for trunk strengthening, but we're certainly in standing, we're going to get those hip rotators a lot too, as well as really the shoulder rotators if you have the person hold on to a stick. So they can essentially hold it out here. You're going to have the therapist grab the opposite sides and try and twist the stick while your patient tries to resist it. So you're not really wanting the patient to rotate because, again, it's a stabilizing exercise. But we'd alternate which way we're pushing or pulling on the stick, twisting it different ways, and having the patient try to engage both their core as well as the other primary joints that rotate, the shoulders and the hips.
Makes for good sword fights.